Thank you very much, Dr. Suparna, for this kind introduction and this invitation to deliver a talk to young, eager, enthusiastic students who are wishing to explore a career in public health. Can I now request Mr. Yogesh to please share the screen slides, please? I'm going to talk to all of you about a very simple topic, which is to do with competencies. Now, competencies have been defined in multiple ways over the years. One of the early definitions of competency has been that it's a characteristic, it's a behavioral characteristic in an individual, which is related to some aspects of success in a person's life. While this to me seems to be a very limited understanding of competency, that it links a certain word competency to something like success, further definitions over the years have actually expanded this understanding to say that we are more focusing on the job when we're talking on the employment scenario. To me, in a very simplistic term, competency is nothing but a combination of knowledge and skills. And why do we want to talk about these knowledge and skills in public health today? All of us are witness to the devastation that COVID-19 has unleashed globally. Several countries across the world, irrespective of the geographical location where they are, whether it's in the global north or in the global south, whether they are a developed country or whether they are a developing country with well-established health systems supported by the public sector, have witnessed the devastation of COVID-19 firsthand. Public health, and when we talk about any such discipline, any such professional discipline, needs people in adequate numbers with the appropriate training. Unless we have the right people to do the job and deliver the services, we are always going to be struggling in what we seek to do as a health system. We do not expect an orthopedic surgeon to probably solve dental problems. Neither do we expect somebody who's trained in surgery to do any kind of surgery on the human body. They would have specialized in certain aspect of the surgery on a certain organ system. To me, therefore, it is obvious that when we talk about public health and when we talk about public health workforce, we are going to need people who are professionals and who are adequately trained within the public health systems. Competencies, or a combination of this knowledge and skills taken together, is one such generic words that helps us summarize what a public health professional should be doing. To illustrate this with an example, if somebody says, learn how to drive a car to a young 18-year-old who has never sat on the steering wheel, to that person, the knowledge would be knowing the traffic rules, knowing where the brake is, where the clutch is, where the accelerator is, how to turn on the car. The skills would probably be managing all these complex different systems together, but the competency is driving the car safely and taking yourself from the origin to the destination. So competency to me is a little bit more than just knowledge and skills. It is composed of the knowledge and skills that you acquire, but competency means what will you do with it subsequently as well. So if we move on to the next slide, competency, if it is the ability to do something, should be intricately linked to the kind of education systems that are designed within individual countries. This doesn't apply just to public health, but it extends to any of the clinical branches that we today see in our world today. In 2010, a very famous Lancet Commission on Education of Health Professionals was launched globally. And its report is a landmark report which has visualized what the 21st century health professional looks like. In this report, I've just tried to summarize on one single slide for you a certain point, which is a very key point from this report. The Lancet Commission says that there are 3 levels of learning. And the very basic level is an informative level of learning, whose objective is to provide information and skills to the participants in the classroom, who go on and acquire this information and skills and use it to become experts in a certain domain. The next level of learning, which is formative learning, builds upon the informative level to add to it socialization as well as the appropriate values. And together, it then goes on to create professionals. But the 21st century is not going to be a century where just the informative and the formative levels of learning suffice. There has been a widespread disruption that we have seen perpetuated by COVID. But even beyond COVID, we realize that there are newer skills which are required. Education programs don't just equip you with skills of today, but they're expected to even equip you with the skills of tomorrow. And this, in addition to the informative and the formative levels, should add up with leadership attributes to create change agents. So when we talk about at an India level, when we talk about what public health needs in India, of course, we need a lot of manpower. We need a lot of people to work within the national, state, and the district and the community levels. But we need them to have the right values, and at the same time, they should be working as transformative or change agents all throughout. Please go on to the next slide. The government of India is very cognizant of this extreme requirement that has come up in the 21st century, and these expectations that we place on our young public health professionals was very much recognized way earlier, even in 2017 and 18. At that time, in a collaborative effort, the Government of India, the Ministry of Health and Family Welfare, suggested what a model course curriculum of a Masters in Public Health program should look like. Now, if I take a step back to try to understand what do public health professionals basically do, in the last 17 to 20 years, I have realized that there are 3 core functions that public health professionals partake in. First is to undertake a very good needs assessment, to understand what the community, what the district, what the state, what does the population need? What do various segments of the population need? Are these needs currently fulfilled, or what probably needs to be done? So it's part of needs assessment. The second important function that is played by public health professionals is actually to intervene or to provide solutions. So public health professionals, after understanding the problem, should be able to devise a program or a project, implement the project, and implement it well. The third function is linked to monitoring the outcomes, undertaking an evaluation, and communicating this to the public and to the policymakers for effective changes in what we are currently doing so that the situation improves. Now, hidden inside all of these 3 big headings are a lot of small skills and knowledge which is required to effectively deliver these public health functions. The model curriculum highlighted by the Ministry of Health and Family Welfare does include 4 broad competency areas, and these are to take the public health system and its challenges, understand and apply all the course learnings to them. The model curriculum also talks about developing, implementing, and evaluating key public health priority areas, developing and demonstrating a capacity in managing the health systems as they exist within our country, both in the public and in the private sector, as well as skills in undertaking research work. Public health professionals are not available in large numbers. Estimates that we have calculated at the country level suggest that we still will persist and have a gap of public health professionals even by 2030. We need a much larger number of public health professionals co-located within the health systems. Estimates of shortfalls range from as much as 25,000 to as high as 40,000, depending upon the parameters that are chosen for the decision making. One of the things that I would like to emphasize to all the people here in the audience today is that we will certainly need not just the institutional or the technological capital to reform our health systems, we are also going to need a human capital. These human beings, these boots on the ground, are required to carve up higher niches in the value chain of the health system. We need to make sure that the competencies that are required for people in India for addressing India's problems are well transferred, that they should be aligned adequately to the context that we are working in, and they should be flexible enough to accommodate student interest as well as further job opportunities. I really would welcome each and every one of us in whatever career or profession that we choose to remember that public health has a lot of requirement of common sense. It requires you to have the passion for reforming the lives of people and at the same time, the dedication to work in settings which are very, very challenging. So thank you very much, everyone. Over to you, Dr. Suparna. Thank you for the opportunity.